My name is Jessica I'm presenting my scholarly project for 490. My clinical experience was at Park Nicollet Midwives. Park Nicollet Midwives Department is a 13 midwife practice among 3 different sites, Brookdale, Minneapolis, and St. Louis Park. I had the opportunity to work with the nurses and the midwives at the Minneapolis location. The population served there are women's health and pregnancy. So they see anyone, they do the well exams, annual exams, pap smears, STD screens, postpartum, as well as women in pregnancy. But it tended to be the more low risk type pregnancies because midwives are advanced practice nurses. They only can practice to a certain level of care. And then once it becomes out of that scope of practice that they can practice within, they have to refer out to the OB doctors. My greatest personal learning experience was probably how to provide that education and referrals to outside resources. Being that it is a clinic setting, you only have, anywhere from like 20 minutes to an hour with these patients. So to provide them with extra resources was pretty critical and important to their success. So one of the places that they refer people to is Everyday Miracles, which is a pregnancy group that provides believes in providing prenatal care regardless of any kind of barriers that you have to every woman. So it's kind of cool. They offer free doulas for women on Medicaid. Minnesota is one of 2 states that do this, and doulas have been shown. Doulas are a support person, non-medical support person there for women during labor, and doulas have been shown. The U of M actually conducted a study that shows better birth outcomes with the use of doulas, so that's really cool that they can provide that and pay for that for people with some socioeconomic barriers. Then the primary goal that I worked with my preceptor to see if we wanted to pursue was if they wanted to provide should we provide prenatal group visits or prenatal group care to women, these certain subpopulations that the midwives desired to care for. So they based this off of something they already do now called centering. The centering model of care shifts from the traditional model of like one-to-one care with the doctor and then the patient to a group setting where it brings 8 to 10 women together with the same due date so that they can interact together, learn together, create these shared experiences. And from that, they found that having this collective to talk about things with and whatnot decreased preterm labor, low birth weights, and then increased things like breastfeeding and child spacing. So the primary goal, like I said, was to survey for the interest of restarting these groups for certain subpopulations. And the midwives really found, as they've practiced, that there's these subpopulations that just needed a little bit more support. So at the Brookdale Clinic, it was single moms and young moms. And then at the Minneapolis Clinic, it was Somali and East African subpopulation. So I created 2 surveys, one for the midwives and then one for the patients. And I had just asking whether they would participate in certain things, certain criteria, maybe barriers to care, or barriers to why these group prenatal visits wouldn't be successful. So I had 18 participants from the midwives and then 13 from patients. And then I also created a PowerPoint that presented my survey findings to the midwives at a group meeting. The evaluation was the data from the surveys. Did the surveys support the question or the goal? Should we restart these groups? Both did. The midwives showed a desire to restart these groups as well as the patients, But keep in mind the patient surveys we surveyed for like 3 weeks and we only got 13 surveys back. So it's small data. And then we also got feedback from the midwives at the meeting. So that was also another evaluation tool to answer that goal question. What went well? I think the surveys answered the question. Should we pursue group prenatal visits? The answer was yes, both amongst patients and amongst the midwives. But what I thought could have been improved was there was a low participation in the surveys, and I think it was just kind of a lack of communication as how the nurses should have passed those out, and were they doing it every time, and just kind of things like that. So we could have got probably a bigger patient response with a maybe better communication amongst the staff and the team. And then some of the questions didn't get answered well, and I think that was just the nurses, we created this survey and we knew the wording, but maybe the patients didn't know the wording, so the questions weren't answered the right way. So I would probably go back and reevaluate some of the questions I had to get a better response. And then also adding some sort of ethnic identifier to understand what subpopulations are need what barriers. So that we could reach those certain subpopulations to create those groups and maybe meet their needs better. So that would be the only other evaluation or only other thing that I thought could have gone better. Yeah, I think their conclusion is to re-survey just to kind of meet those, see if timing will work out and see further along what the barriers are to starting these again. Thank you. Have a good day.